The Fetal and Infant Mortality Review Team is looking at ways to address the infant mortality rate in Tippecanoe County. And after 3 years of gathering data, they've identified where steps need to be taken. FEMA began in 2020 due to wanting to lower the infant mortality rate in Indiana's West Central region. Data from the Indiana Department of Health showed rates for the region were near 6.8%.
We really want our rates to be at like 5 per 1,000 live births, 5 deaths per 1,000 live births, and they're up above that.
Aubrey Kitchell says it's hard to pinpoint the exact impact on why that rate is higher, but it could be due to not having enough resources in the surrounding areas to accommodate high-risk pregnancies. FEMA is made up of a case review and community action team. These teams implement strategies to healthcare systems and people in the community. FEMA presented an overview based on findings of fetal and infant mortality from 2020 to 2022. Findings showed the leading causes of death were related to prematurity complications, unexpected deaths usually relating to unsafe sleep, and unknown causes.
So we review the cases, identify gaps in service, opportunities to prevent deaths, or just to better the overall health of moms and babies, and then we send that over to our community action team to really make it happen.
While they are still in the process of figuring out steps to address these findings, right now they plan to focus on prioritizing prenatal health and offering more educational services, including a community pregnancy support group.
Healthcare systems have been stretched so thin, especially since COVID. There's way more patients than there are staff. They don't have the time to thoroughly sit down and go through, every possible education topic. So having an additional place for people to come and sit in a comfortable atmosphere.
And going beyond educational resources.
Then connection to those additional resources where we might identify like, oh, mom's not going to her appointments because she doesn't have transportation. Well, we know that you can probably get that through your Medicaid service. Let's help you set that up.
With more funding coming in, FEMA is planning to expand their resources to the surrounding counties. More information on the resources that FEMA offers can be found by visiting WFI.com. Reporting at the Tippecanoe County Health Department, Ella Chu, News 18.